Hi everyone, I'm Dr. Izadi from Impristin Wellness Center. PDO stands for polydioxanone. Those are absorbable sutures that plastic surgeons or other surgeons use when they do any procedure inside the body, so they don't have to go back, open up the chest or abdomen to remove the sutures. And they have been using absorbable sutures for the last 100 years, over a century. And the first time a surgeon used the thread for lifting the face was in 1916. And there have been a lot of changes, a lot of new type of threads and procedures. And in 1990, PDO thread was approved in Europe for facelift, and in 2018, finally, FDA in US approved the PDO threads. So the reason that I use PDO threads in my office is because it's a very unique way of building collagen. Some of the threads that don't have barbs, they just absorb, and as they absorb, they build collagen. And there are a lot of studies and biopsy from the tissue showing that after the thread absorbs, there is more collagen formed in that area. And the threads that have barbs, actually they can lift, and this way people don't have to have invasive plastic surgery, which has a very long downtime, a lot of pain, more serious complications, and also more expensive. What can PDO threads treat? So again, there are two different types of thread lift in general in terms of the shape. A part of the threads are the threads that don't have barbs, and they are mono or multi-thread. They just get absorbed and they build collagen without the lifting effect. And the ones that have tiny barbs are called molded threads, and those are the ones that can actually lift the tissue. We can use the threads for face, lifting eyebrows, the corner of the eyes, the corner of the mouth, neck, hands, arms, legs, abdomen, chest. And the lifting effect is actually quite comparable with surgical facelift. When I see before and after pictures from plastic surgeons, I can show you some of my patients who have similar results with just an hour procedure without anesthesia, general anesthesia. So how PDO threads are different from other procedures we do in our practice? With PDO threads, with barbed PDO threads, you can lift the tissue on the face or anywhere else inside the body, including breast, abdomen, knees, and we can lift without making any incision, without general anesthesia, and without significant pain and long downtime. So the other procedures that I do in my office, neurotoxins just paralyze muscles to prevent having lines, which are also an important part of the preventative aesthetic medicine. The fillers, they fill the space. Biostimulators stimulate collagen formation, but none of those can lift. And the PDO thread can lift and give you a very desirable aesthetic result. Who is is a good candidate for a thread lift? Everyone from 20 to 80-year-old is a good candidate for a thread lift. Thread lift is more helpful when you use it as a preventive medicine to prevent having sagging and lack of collagen. In younger patients, I mainly use the thread for border of the lips to make it more defined, lifting the eyebrows, and in older patients, if there is a lot of sagging, and when you lift the face, there is a lot of folded skin on the side, those patients are not good candidates for lifting thread. But even in those patients, we can put monothreads to just build collagen and improve the appearance. So after we place the thread, it takes 3 to 5 months to absorb the sutures, and after the thread absorbs, you see the maximum result. When we use the barb threads, you can actually see some lifting effect right after the procedure. In fact, in many patients, when I do one side of the face, I take a picture and I show it to my patients to compare with the side that is not treated, and the lifting is visible. But the maximum result is in 3 to 5 months after the thread absorbs, and depend on the material that the thread is made of, the longer lasting result is different. PDO threads in general are effective for 1 year, and PLACL threads, which are a combination of PCL and PLLA, they last for 2 to 3 years. To do surgery after I had thread lift? Yes, you can have surgery after thread lift, and that's not a contraindication. Some plastic surgeons who don't do thread lift because they think it's a waste of their time and they can make more money with the surgery, they talk against the thread lift, and they say, oh, if you do the thread lift, it's not possible to do surgery, but that's not true. A lot of plastic surgeons actually do thread lift as well. And yes, so again, doing thread lift is not a contraindication to do surgery, and more and more plastic surgeons add a thread lift to their services because it's becoming very popular during the last few years. What are the side effects of thread lift? Every procedure has some side effects. There is no procedure with no side effect. And with any procedure, when we penetrate the skin, use needle, there is risk of bruising. And the most common side effects of thread lift are bruising and pain. Depend on what type of thread lift we do. We might have no pain or some degrees of pain. Like when I put the thread in the frown line here, or the forehead, or nasolabial fold, I inject lidocaine and completely numb the area. Injection of lidocaine might be a little bit uncomfortable, but after that, you don't feel anything. And nose thread, after injection of lidocaine, you do not feel anything. For the lips, I do nerve block, so you don't feel anything after the numbing. But when we do the lower face thread with molded thread, I numb the entrance completely, so you don't feel anything there. But when I insert the thread with the cannula inside, you might feel some discomfort and pain. Some patients choose to have laughing gas to ease the pain, and some people can tolerate it well. In the past, when I started using ThreadLift in 2014, I used to numb the whole area, and I noticed that the barbs, instead of holding the tissue, they were floating into the fluid and coming out. That's why I don't numb the whole area, because I want the barbs to hold the tissue and lift it. So again, depend on the type of the thread. I mean, the area that we want to do the thread, you might not have any pain, or you might have some pain. After the procedure is done, people might have pain mostly during the first couple of days, and most people with Tylenol and Advil can ease the pain. There are very few patients who had pain for a couple of weeks, but that's not common. How long is the downtime? So after, depend on where we put the thread. When we put it here, forehead, nose, eyes, or the neck, there is not much downtime. When we put it in the lower face, there might be a little bit of swelling, bruising, and usually people during the first couple of days, they prefer not to have solid food, because when you open your mouth wide, the threads are right here, and it might hurt to like have a big burger. So people prefer to have liquids and soup during the first few days. And I always encourage people to sleep on their back, and not to put any pressure in the area that we had the thread, because again, I always show the barbs to my patients. The barbs are so tiny, and if you put too much pressure in the area that we had thread, the barb might release the tissue, and then we end up having asymmetry on the face. Is the procedure painful? Again, I explained that it might be a little bit of pain, or it might not be, and some people want to use laughing gas. How long would I have pain after the procedure? Again, most people have some degrees of pain for a couple of days, which can be handled by taking Tylenol and Motrin. I never had to give anyone any strong painkiller. And I explained the aftercare. You need to be careful not to do massage for at least 1 month. It's better not to have any facial massage or laser, IPL, hot sauna, to just let the thread, stay in and stabilize the placement. Are there any potential permanent side effects? So it is interesting, because sometimes I watch video on YouTube that shows some people, without stereo gloves, with regular gloves, they actually touch the thread while they're putting it in, and the thread touches the hair, and it's not a sterile environment. The skin itself has normal flora that is bacteria, and then you add other bacteria from the hair, your unsterile gloves, and in those situations there is a high risk for having infection. Those who had thread with me, they know that I always clean the skin with chlorhexidine, and when I want to use large cannulas and barbed threads, I always have a very sterile field, sterile sheets, and sterile gloves, and I even change my gloves a few times during the procedure. Part of it is because I have OCD, and the other part is because I don't want anyone to get infection. And even after all these, steps to have a sterile procedure, depend on how many threads we use, I might give patients antibiotic. And imagine when someone doesn't do it in a sterile way, how high the risk of infection is. And if you have a severe infection because of the thread, I've seen pictures of people who had permanent scar because of that. During some conferences that I attended, they presented some cases of severe infection and a scar. So that might be a permanent side effect, but the temporary side effects that might happen with thread, the most common one is dimples on the skin, puckering dimple, uneven skin. And in almost all my patients, if there is any dimples on the skin or unevenness, after usually 2 weeks, it's gone. And I remember one time one of my patients asked me to put some filler in the area that she had a dimple. And then after 2 weeks, she came back to dissolve the filler because we didn't need that, and it corrects on its own. So those are some temporary side effects. And sometimes when people put the thread very close to a nerve, temporarily for a couple of weeks, patients might have some tingling and sharp pain because the thread stimulates and irritates the nerve. But none of those are permanent side effects. And imagine when you have plastic surgery, if the plastic surgeon is not skilled, they might actually damage your nerves and cause some permanent damage. How much does it cost to do thread lift, and how long does it last? So like any other procedure that we do, we are very transparent, and the pricing for everything is on the website. On our website, there is one page dedicated to thread lift, and at the end of that page, there is the pricing. Depend on what type of thread we use, how many we use, and even different type of thread in terms of the material that the thread is made of, the price is different. And you can go to the website to see the pricing. We use in general 2 different type of thread in terms of the material that the thread is made of. One is PDO, the other one is PLACL. PDO thread is just the regular PDO thread that everyone else uses, and the PLACL is combination of PLLA and PCL. PLLA is the same material as Sculptra, and PCL is another type of thread. So in the past, I used PLLA and PCL. One was too stiff and the other one was too soft. And I decided just to use PLACL thread, which is combination of PLLA and PCL. And it's not too soft, not too stiff. And usually PLACL lasts 2 to 3 years, and PDO lasts around a year. It takes 4 to 6 months for the thread to absorb, and then after that, the result lasts either 1 or 2 to 3 years. Most of my patients who had PDO thread, they usually come back around 2 years to do it again. And even, some of my patients who had PDO, and I see them 2 years after the thread, their skin still looks better than the time before having the first PDO thread. So definitely the thread helps to build some collagen. Is this an alternate treatment to surgical facelift? There are some certain cases that they need surgical facelift because they just have too much sagging skin, and there is no way to improve the overall skin condition with just thread lift. And for those patients, it's better to do surgery. And when I do the consultation, I always tell my patients if they need surgery, I just tell them you need to find a good surgeon to have surgery, and the thread lift does not give you the result you want. But in general, thread lift is more for younger people to prevent having sagging skin. So it's always good to be proactive and do something before you have the sagginess. Just keep it up and prevent having too much sagging skin, because at that point surgery would be the only option. Next question: how long the procedure take? Usually the lower face molded thread takes around an hour. I block 1.5 hours just in case if my patient needs more time to feel numb. And besides, I don't want to rush anything. When we do the thread in the lines, the 11s, or nasolabial fold, that takes only like 10 minutes. The nose thread takes like 15 minutes to do it from the beginning to the end. And I even have some videos of my patients who had nose thread, and in the video they say that, oh, I didn't feel anything, I didn't have any pain. And I usually like block 1 hour for nose thread just because I want to go over everything before and after care and not to rush. How many thread lifts have you done? So I started doing thread lift in 2014, and it was FDA approved in 2018. And I was doing it what we call off-label, because doctors are entitled to do any procedure they recognize as beneficial and call it off-label. So most providers who do thread lift, probably they have 2-3 years experience. But I've had almost 10 years experience with the thread. On average, every week I do between 2 to 5 thread lift. And you can do the math. I've done a lot of thread lift and feel very comfortable doing it. How much does it cost approximately to do a full face? So it depends on what you call full face. So the lower face, usually we put 2 molded thread here at the jawline, 2 molded thread in the upper part. And then, if you want to lift the eyebrows, that's another type of thread. And each one of these have different pricing. When I see you for consultation, we can go over it and I can give you an estimate how much it would cost, depending on what you want to do. And then nose thread, nasolabial fold, the lip line, frown line, forehead, these are all, different things. But most people who do the lower face, in general, most people just need 4 molded thread on each side of the lower face. And every PDO molded thread is $200, and PLACL threads are 3 times more expensive than PDO thread. What's the average cost? Again, when I see you for consultation, we can go over the pricing, but the pricing is also on the website, depend on what kind of thread, what type of thread in terms of material that it's made of. There are so many different things involved to calculate the final price. Is filler safe? Well, today we're talking about thread lift, but I'm happy to answer your question. Fillers are safe if it's done by a trained practitioner and in the right place with the right filler. There are some places that I never put filler, like the nose, the forehead, this area, I never put any filler because there is higher risk of blindness. There are very few patients who are a good candidate for filler under the eye. I have a new ultrasound device that I might use for some specific patients to use filler in some parts of their nose. And again, safety is the most important thing to consider. Can threads be used to add definition to chin or jaw versus filler? For the jawline, definitely thread is perfect to make the jawline defined. We can also use fillers or radius. And for the chin, if you want to increase the volume of the chin for people who have a smaller chin, I always show them the side view with the line connecting the tip of the nose to the lower lip and the chin. If there is any gap here, the best thing to do is the filler. The threads do not increase volume. And in the chin, we need volume, and we should use filler. There is no thread increasing the volume as much as filler. How effective is thread lift for neck and jowls? I have some pictures of some of my patients, and I will add more because recently I treated a few more patients for the neck and the submental area. The result of dual thread is just amazing. And it's almost comparable with surgery, but there are specific patients that I choose to do the thread in their neck. Not everyone is a good candidate for lifting thread for the neck area, but we can always put mono thread, soft mono thread anywhere, including the necklines, to just build collagen. And one of my patients that I treated in 2014, I have her before and after picture on my website, which was the after picture was 3 months after just putting mono threads, like she had 200 threads in her neck and lower face. Not a barbed one, but the mono thread to just build collagen. And the result was just amazing. Can you see the thread after the procedure? No. You do not see the thread no matter if it's PDO, which is purple, or PLACL, which is translucent. The thread needs to be in subdermal area, not too superficial to be seen under the skin, and not too deep to cause damage to the underlying tissues. So this is why finding a provider who is well experienced is important to avoid these side effects that might happen. Some of the side effects of the thread lift depend on the provider's experience, and some can happen with anyone. Like there is always risk of bruising, swelling, pain, and infection. how long would it last at the neck and jowls? So the duration of the effectiveness of the thread depends on the material and also the type of thread that we use. In general, PDO thread lasts 12 to 15 months, PLA seal 2 to 3 years. Any scarring at the insertion site, especially for the nose thread? I've probably the most common type of thread that I've done is nose thread. And I had one patient who was on immunosuppressor, and he did not mention that. And he had the opening of the thread, the area that we placed the thread in, took a long time to heal, but there was no permanent scar. It might take longer when you have too many threads tied in one area to heal, but there is only one type of permanent scar that I've seen, not in any of my patients, but in conferences that they presented rare cases. It's 0.06%, very rare, and it's because of severe infection. So when I give you antibiotic and I ask you to take it, you need to take the antibiotic because it's necessary. Again, in spite of working in a very sterile environment, the skin itself has bacteria as normal flora, and it might go under the skin and cause infection. Can you have thread done after having done all therapy procedure 2 months ago? Yes, you can have thread after any other procedure, but when you do the thread for at least a month or two, you should not have any all therapy, IPL, or any laser, and you should not have, hot sauna. What happens if the thread doesn't resolve as expected? You mean dissolve? The thread always dissolves. The threads PDO and PLA are biodegradable, meaning that they completely absorb. There is absolutely no case report of any thread not dissolving. They all dissolve, but in some patients might take longer than 6 months. I had some patients who had PLACL, and it took almost a year to completely dissolve the thread, but it eventually dissolves. And in most patients, PDO thread absorbs completely in 3 to 5 months. Can the thread cause scar tissue? It is possible, especially if the provider is not well experienced. Can we do a mini thread lift to test if our skin is compatible? So there is no case report of any allergic reaction to PDO or PLACL. And unfortunately, every box of the thread lift comes in 4 or 8 threads. And those are expensive threads, and we cannot open a box just to try one of the threads under the skin. If you pay for the whole box of 4 or 8 threads, we can do that, but I don't see any reason to be concerned because, again, there is no reported case of allergic reaction to any of these. One type of patients that I usually avoid doing the thread lift is the ones who are prone to have a keloid after surgery. because I'm not sure how they would respond to the PDO thread, and I'm not sure if they would have keloid or not. So that's why I don't do thread lift on people with history of keloid. Can thread lift result cause the sagging to be worse after 2 to 4 years? No. The thread lift does not make the skin look or feel worse, because all it does, it stimulates building collagen. So it definitely, the skin will be better than before the thread. And if you decide not to repeat the thread, you just continue losing collagen as a part of aging, and it does not cause any harm if you don't repeat the thread lift. It does not make the sagging worse. Absolutely not. Do you accept care credits? So I don't, but I have good news that I just signed up a contract with Repeat MD, and they will help me to have an option for all my patients to use something like care credit and be able to pay for the procedures over time. So stay tuned. I will let you know about that. So Cindy asked, share how you always share the validation date of the product you use, as other doctors never share that information. So, yes, so all of you who had any procedure with me know that as a habit, I always show the expiration date on everything I use. And some of my patients make fun of me, and they just say, oh, I trust you, you don't need to show it to me. But as a patient, I always wanted to know what they put in my skin or in my body, and I wanted to be informed. That's why I always want to let my patients know what I use and what is the expiration date for anything any product I use. What are the side effects or downside of having this procedure? So with the thread lift, there are some rare side effects other than common side effects that I just mentioned. I had 2 patients who had the thread moving toward the surface of the skin, and then I had to take it out. And the reason for that is because in some patients, some part of the thread absorbs faster than the other parts. In general, I try to tie the end of the threads and then put it under the skin so it will be anchored and secured. But even after we tie it, this part of the thread might absorb faster than this part, and then this part of the thread is free, and with your muscle movement it moves and eventually comes out of the skin. So those 2 patients, I had to remove the thread, because once the tip of the thread is out, it can cause infection, and we have to remove it. Again, it's rare, but it can happen. And if the thread is close to a nerve, especially at the jawline, it might irritate the nerve. It might cause tingling or sharp pain. You might have pain when you open your mouth. But usually that side effect resolves on its own in a couple of weeks.